and shadows fall. I'll be beside you whenever you call. When worries weigh heavy and fears take flight, I'll be your strength, guiding through the night. And when the days are dark and heavy on your heart, I'll be the voice to guide you through the dim. Strong walls may crumble, but within you've got the spark. Just turn the key, let light dissolve the grim. Did you think you were alone in your feelings? Strike a match, let your inner strength be seen. Welcome to all things serious. In the depths of your despair, where demons roam, I'll be the hand to hold. You're never alone. When storms rage fierce and winds blow strong, I'll be the shelter in your soul where you belong. Welcome to all things serious.
Hello, hello, hello. Welcome in, everyone. To people that are new in this channel, welcome in. To the OGs, welcome in. So we got Mount Wanderer, how you doing? Westside Accountability, how you doing? Jenna, how you doing? Vic Ferrari, Juicer, Random, Gregory, Sarah, how you doing? Connie Corso's mom, how you doing? Intergalactic, how you doing? Lisa, how you doing? So, I have a few people in the community, JH, how you doing? That suffer with, I got it random, and if you want me to share it on here, I will. It's up to you. So, BB Beyond Amazing, how you doing? I have a few people on here that struggle with epilepsy. I have a member in this community that also has PNES. Psychogenic non-epileptic seizures. You know, and I was doing research, you know, and I'm going to share this research because epilepsy and mental health collide with each other, amongst other things. And I think it's important for people to understand people that struggle with epilepsy, because there's things that they can't do in life with having epilepsy. Okay, so I want to start with epilepsy, also known as a seizure disorder. It is a brain condition that causes recurring seizures. There are many types of epilepsy. In some people, the cause can be identified. In others, the cause is not known. Epilepsy is common. It is estimated that 1.2% of people in the United States have active epilepsy, according to the CDC. Epilepsy affects people of all genders, races, ethnic backgrounds, and ages. Seizure symptoms can vary widely. Some people may lose awareness during a seizure, while others don't. Some people stare blankly for a few seconds during a seizure. Others may repeatedly twitch their arms and their legs, movements known as convulsions. Having a single seizure doesn't mean you have epilepsy. Epilepsy is diagnosed if you've had at least 2 unprovoked seizures in the last 24 hours apart. Unprovoked seizures don't have a clear cause. Treatment with medicines and sometimes surgery can control seizures for most people with epilepsy. Some require lifelong treatment. For others, seizures go away. Some children with epilepsy may outgrow the condition with age. Symptoms. Seizure symptoms vary depending on the type of seizure. Because epilepsy is caused by brain activity in the brain, certain activity in the brain. Seizures can affect any brain process. Seizure symptoms may include temporary confusion, a staring spell, stiff muscles, uncontrollable jerky movements of the arms and legs, loss of consciousness, psychological symptoms such as fear, anxiety, or deja vu. Sometimes people with epilepsy may have changes in their behavior. They also may have symptoms of psychosis. Most people with epilepsy tend to have the same type of seizure each time. Symptoms are usually similar from episode to episode. Smiles, welcome in. How you doing? Warning signs of seizures. Some people with focal seizures have warning signs in the moments before a seizure begins. These warning signs are known as aurora. Warning signs might include a feeling in the stomach, or they might include emotions such as fear. Some people might feel deja vu. Auroras also might be a tasteful or a smell. They might even be visual, such as a steady or a flash light or color or a shape. Some people may experience dizziness and loss of balance. And some people may see things that aren't there, known as hallucinations. Seizures are classified as either focal or generalized, based on how and where the brain activity causes the seizure begins. When seizures appear to result from activity in just one area of the brain, they're called focal seizures. These seizures fall into 2 categories. Focal seizures SPS, simple partial seizures. These seizures don't cause a loss of awareness, also known as consciousness. They may alter emotions or change the way you look, change the way things look, smell, feel, taste, or sound. Some people experience deja vu. This type of seizure may result in involuntary jerking of a body part, such as arm or a leg. A focal seizure may cause sensory symptoms such as tingling, dizziness, and flashing lights. Focal seizures with impaired awareness, once called CPS, complex partial seizures. These seizures involve a change or a loss of consciousness. This type of seizure may seem like being in a dream. During a focal seizure with impaired awareness, people may stare into space and not respond in typical ways to the environment. They also may perform repetitive movements such as hand rubbing, chewing, swallowing, or walking in circles. Symptoms of focal seizures may be confused with other neurological conditions, such as migraine, narcolepsy, or mental illness. A thorough exam and testings are needed to tell if symptoms are the results of epilepsy or another condition. Focal seizures may come from any lobe of the brain. Some types of focal seizures include temporal lobe seizures. Temporal lobe seizures begin in the areas of the brain called the temporal lobes. The temporal lobe process emotions and play a role in short-term memory. People who have these seizures often experience an aurora. The aurora may include sudden emotion, such as fear or joy. It also may be a sudden taste of or smell. Or an aurora may be a feeling of deja vu, or a rising sensation in the stomach. During the seizure, people may lose awareness of their surroundings. They also may stare into space, smack their lips, swallow, or chew repeatedly, or have movement of their fingers. Frontal lobe seizures begin in the front of the brain. This is the part of the brain that controls movement. Frontal lobe seizures cause people to move their heads and eyes to one side. They won't respond when spoken to and may scream or laugh. They might extend one arm and flex the other arm. They also might make repetitive movements such as rocking or bicycle pedaling. Occipital lobe seizures. These seizures begin in the area of the brain called the occipital lobe. This lobe affects vision and how people see. People who have this type of seizure may have hallucinations, or they may lose some or all of their vision during the seizure. These seizures almost might cause eye blinking or make eye moves. And then you have generalized seizures. I am learning a lot. Just saying. These are serious symptoms to look out for. You got absent seizures, previously known as petit mal seizures, typically occur in children. Symptoms include staring into space with or without subtle body movements. Movements may include eye blinking or lip smacking and only last 5 to 10 seconds. These seizures may occur in clusters, happening as often as 100 times a day, and cause a brief loss of awareness. Tonic seizures cause stiff muscles and may affect consciousness. These seizures usually affect muscles in the back, arms, and legs, and may cause a person to fall to the ground. Atonic seizures, also known as drop seizures, cause a loss of muscle control, since this is the most often affects legs. It often causes sudden falls to the ground. Clonic seizures are associated with repeated or rhythmic jerking muscles movements. These seizures usually affect the neck, face, and arm. Myoclonic seizures usually appear as sudden brief jerks or twitches and usually affect the upper body, arms, and legs. And I'm pretty sure you guys have heard grand mal seizures. They now call it tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic type of epileptic seizure. They cause sudden loss of consciousness and body stiffening, twitching, and shaking. They sometimes cause loss of bladder control and or biting of the tongue. Causes. Epilepsy has no identifiable cause in about half the people with the condition. In the other half, the condition may be traced to various factors, including genetic influence. Some types of epilepsy run in the families. In these instances, it's likely that there's a genetic influence. Researchers have linked some types of epilepsy to specific genes, but some people have genetic epilepsy that isn't hereditary. Genetic changes can occur in a child without being passed down from a parent. For most people, genes are only part of the cause of epilepsy. Certain genes may make a person more sensitive to environmental conditions that trigger seizures. Head trauma. Head trauma as a result of a car accident or a traumatic injury can cause epilepsy. Factors in the brain. Brain tumors can cause epilepsy. Epilepsy also may be caused by the way the blood vessels form in the brain. People with blood vessel conditions such as arteriovenosus malformations, arteriovenosus malformations and cavernous malformations can have seizures. In adults older than the age of 35, stroke is a leading cause of epilepsy. Infections, meningitis, HIV, viral. I'm reading words I've never read before, so give me a moment. VE, viral encephalitis, and some parasitic infections can cause epilepsy. Injury before birth. Before they're born, babies are sensitive to brain damage that could be caused by several factors. They might include an infection in the mother, poor nutrition, or not enough oxygen. This brain damage can result in epilepsy or cerebral palsy. Developmental conditions. Epilepsy can sometimes occur with developmental conditions. People with autism are more likely to have epilepsy than are people without autism. Research also has found that people with epilepsy are more likely to have attention deficit hyperactive disorder, and other developmental conditions. Having both conditions may be related to genes. What triggers seizures? Alcohol, flashing lights, illicit substance use, skipping doses of anti-seizure medication or taking more than prescribed, lack of sleep, hormone changes during the menstrual cycle, stress, dehydration, skipping meals, or illness. Miss Tom, how you doing? Holy Roman Empire Pope Aries. I like that. Aries, how you doing? Allegedly speculating, how you doing? Certain factors may increase your risk of epilepsy. Age. The onset of epilepsy is the most common in children and older adults, but the condition can occur at any age. Family history. If you have a family history of epilepsy, you may be at risk of seizures. Head injuries. Head injuries are responsible for some causes of epilepsy. You can reduce the risk by wearing a seatbelt while riding in a car. Also, wearing a helmet while bicycling, skiing, riding a motorcycle, or doing activities with a high risk of head injury. Stroke or other vascular diseases. Stroke and other blood vessel diseases can cause brain damage. Brain damage may trigger seizures and epilepsy. You can take steps to reduce your risk of these diseases. Limit alcohol, don't smoke, eat a healthy diet, and exercise regularly. Dementia. Dementia can increase the risk of epilepsy in older adults. Brain infections. Infections such as meningitis, which causes inflammation in the brain or spinal cord, can increase your risk. Seizures in childhood. High fevers in childhood can sometimes be associated with seizures. Children who have seizures due to high fevers generally won't develop epilepsy. The risk of epilepsy increases if the child has a long fever associated with a seizure, another nervous system condition, or a family history of epilepsy. Complications. Falling is a complication. Drowning, car accidents, trouble with sleep, pregnancy complications, memory loss. People with epilepsy are more likely to have mental health conditions. They may be a result of dealing with conditions itself, as well as medicine side effects. But even people with well-controlled epilepsy are at risk. Emotional health problems may affect people with epilepsy. Depression, anxiety, suicidal thoughts and behaviors. Other life-threatening complications of epilepsy are not common, but may happen. So they have sudden, unexpected death in epilepsy. People with epilepsy also may have a risk of sudden, unexpected death. The cause is unknown, but some research shows that it may occur during heart or respiratory conditions. People with frequent tonic-clonic seizures or people whose seizures aren't controlled by medicine may be at a higher risk of SUDEP. Overall, about 1% of people with epilepsy die of SUDEP. It's most common in those with severe epilepsy that doesn't respond to treatment. So status, so SE. I can't pronounce the word, so I'm going to spell it. Epilepticus. This condition occurs if you're in a state of continuous seizures activity lasting more than 5 minutes. Or it may occur if you have seizures without regaining full consciousness. In between them, people with SE have an increased risk of permanent brain damage or death. So I got a message from somebody in the community, and I want to share it. Okay. They reached out to me on X, and they gave me permission to read it out to you guys. And then I'll get on to PNES seizures. So my story is long. Starts at 2 months old, to be honest. Was abused by my father, then separated from siblings. Adopted at age 4. Severely abused back in foster care at age 18. A lot of trauma. Hit an ear and head at age 17. I can't remember. Seizures started 2 weeks before my 18th birthday. They've tried 10 different meds for my seizures. Can only tolerate Tegretol at the lowest doses possible for my body size. Anxiety and depression meds increase seizures. I started having joint and other pains in 2016. Found out recently it's Ehlers-Danlos syndrome. Can't do the pain meds. Physical therapy made it worse. My husband left in 2016, days before Christmas. We have 4 kids. The youngest is the only one that doesn't have autism. A psychiatrist warned in 2013 that one more thing could break me. I've not been the same since he left. I homeschool our children. Doctors lecture to lower stress, but how? I'm stuck in a rut. Depression and stress causes pain to be worse. Worse pain causes more stress and depression. I can't organize our place. I'm stuck. A couple of weeks before Christmas, I had a breakthrough seizure at night. Scared my youngest, who's never seen me have one. I was 6 years and 4 months seizure free. I need to figure out what caused the breakthrough seizure. My kids need me. I'm scared to sleep. They cause my heart to stop, then go real fast when I have them at night. I figured out stress, etc. But I've been extra stressed for 8 years. Sorry so long. There is a lot left, okay? Don't have to read the rest. So can we put prayer hands in chat, please, for our friend that is struggling? And hopefully doctors can help and find the strength, or just find a way to help her with these seizures. Turtle Talk, how you doing? Liz, how you doing? Crafty Girl, how you doing? So I want to move forward. Sweet and Sleuthy, how you doing? Regina, how you doing? Miss Tom, how you doing? So we're going to move forward to psychogenic non-epileptic seizures. What is psychogenic non-epileptic seizure? It involves attacks that resemble epilepsy-related seizures in symptoms and signs, but abnormal electrical activity in your brain doesn't cause them. Instead, the seizures are a physical reaction to underlying psychological distress. A psychiatric diagnosis for PNES is conversion disorder, as a mental stress is being converted into a physical symptom. Conversion disorder is also known as functional neurological symptom disorder. Many people with PNES have experienced trauma. People who have it aren't faking the seizures. They have no conscious or voluntary control over them. Many people first receive mixed diagnosis of epilepsy. It is also possible for someone to have both PNES and epilepsy-related seizures. This happens in 10 to 15% of cases. Other names for this condition are psychogenic non-epileptic spells, psychogenic non-epileptic episodes, and attacks. What does PNES most commonly begins in young adulthood, but it can start at any age. Is most likely to affect women and people assigned female at birth, AFAB. The men in people assigned male at birth. So it affects more women than it does men. Factors may increase your risk in developing PNES include history of sexual abuse, history of physical abuse or neglect, coexisting psychiatric conditions such as depressive disorder, PTSD, or personality disorder, a tendency to suppress or hold in your emotions. PNES is more relevant in the veteran population than a civilian population due to higher trauma exposure in veterans. How common? Is PNES? Researchers aren't sure how common it is, but 20 to 40% of people who see epilepsy specialists for intractable, untreatable seizures receive a diagnosis of PNES rather than epilepsy. Symptoms and causes. So, with healthcare providers, while healthcare providers, they can't determine if someone is having a PNES attack or an epilepsy related seizure based on observations alone. Seizure symptoms highly suggest convulsion type seizures that are over 10 minutes long, convulsion type seizures with retained awareness, rapid side to side head movements, out of phase limb movements, eye closed unresponsiveness, pelvic thrusting, changing patterns of movement. What causes it? Researchers think the symptoms of PNES are defensive mechanisms that develop in response to underlying psychological distress. Some may be distressed because of unresolved or untreated psychiatric conditions. Common psychiatric conditions that occur with PNES include PTSD, depressive disorders, dissociative disorders, somatic symptom disorders, personality disorders. And I don't know what somatic is, so I'm looking that up right now. Many people with PNES meet the criteria for conversion disorder, also known as functional neurological symptom disorder. Conversion disorder is a mental health condition that manifests as a physical symptom. The symptoms happen because your brain converts the effects of a mental health issue into disruption of your brain or nervous symptoms. Some physical conditions, such as chronic pain or fibromyalgia, may put you at risk for PNES. A history of childhood trauma, of sexual and physical abuse is a known risk factor for the development of PNES. In addition, other major stressors in adulthood, such as complex grief or relationship trauma, can put you at risk for PNES. Will be, how you doing? Oh, that's not good. I'm sorry to hear that, Will be. I'm sorry to hear that. So, how is it diagnosed? It can be difficult for healthcare providers to tell the difference between PNES and epilepsy-related seizures based on observation alone. This is because no one seizure sign is specific to it. Most reliable way for providers to diagnose it is by recording seizures with video, EEG. An EEG measures and records your brain's electrical signals. During an EEG, a technician places small metal discs, electrodes, on your scalp. These electrodes attach to a machine that gives your healthcare provider information about your brain's activity. If you have PNES, the video EEG will show normal electrical brain activity during the seizure. Management and treatment. How is PNES treated? The main treatment for PNES involves diagnosing and treating the underlying psychiatric symptoms contributing to it, as well as addressing the symptoms directly. Anti-seizure medication does not help. Treating symptoms. The go-to therapy for PNES is psychotherapy, talk therapy. Psychotherapy involves talking with a mental health professional, such as a psychologist, about situations that cause emotional distress. Your therapist can help you identify and change unhealthy emotions, thoughts, and behaviors to cope with stressful events more effectively. Studies show that cognitive behavioral therapy, CBT, a type of psychotherapy, is most effective in treating PNES or conversion disorder. If possible, it may be beneficial to seek mental health professionals who have experience with CBT and PNES. PNES specific therapies often focus on education about types of seizures, identifying and managing common seizure triggers, past or present stressors affecting the PNES, improve the motion management skills using relaxation training. This is some detailed stuff. This is some very detailed stuff. So, somatic symptom disorder in adults. That's going to be another live because I've never heard of this disorder. That's going to be another live. So, depression. What is the relationship between depression and epilepsy? So before I continue on, I'm going to drop the links of the websites I used. Paste. Because I don't pay for them. So, what is the relationship between depression and epilepsy? In a study of adults age 18 years and older, researchers found that adults with epilepsy were twice as likely to report feelings of depression in the previous year compared to adults without epilepsy. Also, adults with active epilepsy were 3 times more likely to report depression in the prior year as adults without it. Additional research results show the following. Some of the brain areas responsible for certain types of seizures also affect mood and can lead to depression. A strong relationship has been shown between severity of epilepsy and depression. The more severe of the epilepsy, the more severe the depression. The link can go both ways. People with depression may be at risk for developing epilepsy. Hormone levels can also trigger depressions, especially low estrogen levels. Living with challenges of epilepsy, such as stigma, fear of disclosure, the unpredictability of seizures, bullying, financial troubles, changes in relationships, work, or school, can also lead to depressed thoughts or feelings. Seizure medication may contribute to changes in mood. Some medication may help mood while others may worsen mood. In 2008, the USDA or the FDA issued general warnings that anti-epileptic drugs may increase the risk of unaliving yourself or thoughts of it. Found that in 2009, a review found that many other factors were not addressed, including the risk of depression in people with epilepsy. People taking any seizure medication should be advised of possible changes in mood, thoughts, or other changes, and consult with their healthcare team if these occur. People with epilepsy are more likely to develop depression and other mood disorders even before they have their first seizure. This suggests that the changes in the brain that make a person susceptible to seizures also make them more susceptible to depression than the general population. What types of depression? Major depressive disorder, persistent depressive disorder, premenstrual dysphoric disorder, postpartum depression, substance or medication-induced depressive disorder, depressive disorder due to another medical condition, disruptive mood dysregulation disorder, and seasonal affective disorder. Man, the struggle. What's up, Jay? How you doing? So, those of you that struggle with epilepsy and seizures, I don't understand what you're going through. But just know I'm here for you. For whatever you're going through, I'm here for you. So just know I'm here for you. Because seeing the different types of struggles people with epilepsy have, it's hard. Because there's things you can't do, like drive. You're less independent when you have epilepsy. You know, so when you're not able to be independent, that's depressing. You know, my friend Jenna, she had so she has psychogenic non-epileptic seizures, and it happened while she was driving and got into an accident. You know, I had a friend of mine back in the day that had a seizure while driving a pickup truck with people in the bed of the truck and hit a light pole on the highway. Good thing everybody survived. But now he can't drive no more until he goes at least 1 year, without an episode. Shift happens. How you doing? P. Barnes, how you doing? So I'm pretty sure for those of you that don't know about seizures or epilepsy, when you listen to this video, you're going to learn a lot. I learned a lot. Just having an understanding of people who have epilepsy. Some people aren't independent enough because of certain things, and they get judged for it. So, you know, not at the moment, Crimson, but thank you. You know, and Jay, if you ever want to do a live on mental health, you know, and talk about it, I'll be more than welcome to come up on your panel and talk about it. So I don't do open panels all the time, Crimson. I do open panels. Yeah, I have to respond. I've just been real busy. And when you came in, it reminded me of the email that I got to reply to. So I'll email you back. But I have a few friends that deal with it. And Jenna and Random talked about it. And I said, this is going to be a hot topic to cover because I don't know much about it. And Johnny, how you doing? Miss you too. This is going to be a topic I want to learn about and people in this community can learn about. and understand people who struggle with epilepsy and seizures and psychogenic non-epileptic seizures and their struggles. You know, we got to understand people and their struggle instead of judging those who struggle with mental health conditions or physical conditions. Or you got people who have chronic pain, like MS. MS is an invisible pain. You can't see it, but it's there. You know, I like P. Barnes. If you look at P. Barnes, he just said he's been epileptic since 2001. But if he came up here on camera, you wouldn't even know that. If you talked to him, you wouldn't even know that. Kid Kitty, how you doing? Some of these things cripple us mentally. So, but I want to thank you guys for being here. Thank you for allowing me to share with you guys something I learned today. Tomorrow, I'm going to do open panel, open discussion. So, and I'm going to cover this again because I was supposed to have a guest come up on panel that deals with it, with psychogenic non-epileptic seizures personally. You know, so you know, I'm going to do, you know what? You know, I was going to end this live, but I guess I will do open panel. I will do open panel. All right. So people can come up. I will do that. I'm going to do open panel. And by the way, I am so happy. I'll talk about it tomorrow. Crimson, can you turn your camera on for a second so I can make sure? All right, you can turn it off. You can turn your cameras off. All right. Hello, everybody.
Hello, hello.
So,
How are we?
So P. Barnes is also a therapist, well, a counselor. Are you a therapist, P. Barnes?
Yes, I'm a therapist. I'm a counselor. and I'm an epileptic.
Hold on just a second. I got somebody else coming up.
Yeah.
Is that you, Random?
Yes.
Okay. All right. So I read a message earlier about somebody who struggles with seizures, and that was Random.
Yes.
And I will tell you, reading that took a lot of strength because I read it earlier and cried.
I cried
Just
while
saying.
I was typing it. To be honest, I cried while I was typing it. But yeah, I left a lot out. But I don't know exactly the cause of mine because I have both. But mine are in the temporal lobe area. I was hit in the left ear by a bully at school in that area. So that's what they assume was the cause of mine.
What types do you have? Do you
I've
have
had my first one was at night. Grand mal, really bad. I woke up. My foster grandmother had said that I went walking around the house looking for cigarettes. Yes, I was smoking before I was 18. And she was like, no, I took them from you. And I kept crying and screaming. And then I was crying for a bear. I did not remember it. I thought she was crazy. Until the next one I had, I woke up from. The ones I have right now at night, the first one I had, my 6-year-old never saw. She was like 2 months old when I had my last seizure. Before my breakthrough, I was sleeping in the bed next to her. And I woke up yelling no. That is a classical thing that I would do before. I would wake up and yell no, and then the seizure would start. And I didn't, I thought I had dreamed it. Because, I was I hadn't had one for almost 6.5 years. The next day, I was sitting and just chill, relaxing, and I had a small seizure. And I was like, I just started crying. I was like, that was a breakthrough. I now have to sleep next to him. I'm a single mother of 4 with special needs. I have to sleep next to my oldest. He remembers the seizures, so it's not as much to scare him. Even though one last night I know scared him. I had 3 last night. They have stopped in my heart, so before I figured out CoQ10 helps the heart. Because I had a bad neurologist back then. I was like, I'm going to figure this out because, I had kids. That did help with the heart, but not the seizure still. But just suddenly, when she was 2 months old, I didn't have one. I'm on Tegretol. I have refractory epilepsy, which means Tegretol is like friggin' candy. But I have to take something.
You get warning signals that one is
Yes,
coming?
I get them more in my head, like I'm kind of dizzy all of a sudden. And like I went to a hearing recently for disability. Now the pain causes it's on the left side, and so it goes into my head too, which causes brain fog. Even worse, epilepsy. You already have flipping brain fog, so imagine I really have it now. So during the hearing, I had brain fog, so I was trying to explain to them the seizures and all. I have an aura, I would say about 50% of the time, and I know from experience when you have a seizure, your muscles in your hands are going to contract. You're going to be grasping onto whatever you have, right? I know to grab onto whatever's closest to me because my first falling down seizure was in 2014, 2015. I could walk during a flipping seizure before it because I've had every kind of seizure. Grand mal. I've had 2 status epilepticus that last over 30 minutes. How I'm still here, grace of God. How I wake up before the seizure, I'm saying grace of God because they stopped my heart. I have those little things they put at the hospital that check your heart and oxygen.
Mm-hmm.
I have one next to me because of it. But I am trying to figure out what has started the breakthrough because, like I said, for 8 years, it's been stress, stress, stress.
The stress does bring seizures in. So is with epilepsy, over 100 different types of epilepsies.
Yeah.
And reactions are different. But I call this as a blessing for myself that I get warning. I've learned what those warnings are, so I'm able to I haven't broken any bones in last 7, 8 years. So that's a blessing for me. So you need. I mean, the thing is, usually with MRI scan and CT scan, it's very hard to work out unless there's a real serious damage on the brain. It wouldn't really show up on CT scan and MRI scan. So what they normally do is they look at your symptoms, they look at how your brain processes, and then they work out exactly where the injury might be. So in my case, I lose my speech. So they worked out exactly the left hand side, uh, part of my brain, like
What are you doing,
what
Mr. Barnes? You're making a lot of noises in the background.
No, I'm not making any noise.
Sorry, that could have been me. I was doing something for my daughter real quick.
Oh,
I
okay.
apologize.
It's all right.
Sorry.
Go ahead, Barnes.
So,
You're good. Sorry.
no, that's great. So you need to talk to the neurologist, and the neurologist will ask you a few questions. And once he or she goes through those questions, they will be able to try and pinpoint where the injury might be. Uh, and then, I mean, I'm on 3 different types of medications because I have 2 different types of epilepsies. I have a grandma, and I have Jackson. So with Jackson, it's only the right side of my body that starts to in 1 or 2 shakes. And like you were saying, that you need to grab something, that happens. How we react to it after we come around, that also is like a confusion is one of the most normal reaction that we have when we come around. So you need to stop being harsh on yourself, and the best way to do it is by talking to other people who have epilepsy. Because I wasn't able to cope until I spoke to some stranger in a pub who was epileptic, and he sat me down and he made me understand what was happening in my head. And I managed to find what I call my norm. Uh, but that takes time. So if you continue talking, I'm listening, and I might be able to give you a few ideas, a few tools that you might be able to use to help you to find a coping mechanism. This is all it is. Medications work to a certain point, and because of my epilepsy, it also affects my mental health. So I have to face depression to go with it, and then there's memory loss as well. So tell me, tell me in detail the last time you had a seizure. What happened? Just when you realized it was going to happen.
My last one was last night. I was sleeping.
Oh, God.
And my son was actually asleep. And right before the seizure, of course, I yelled no, and he jumped up. And he would not, until I was okay, he stayed right there. But my heart didn't go as fast, but it didn't, it wasn't fast enough for us to have to monitor it. During the day, the last one was 2 days ago, actually. So I'm doing something right somewhere for the day ones to be less. I was actually very frustrated and mad at the moment.
Right.
Um,
So when you
according,
said no, that probably was you realized that you were about to have a seizure and you were trying to tell your brain not to go through with it.
Yeah, and see, those are the ones at night that I yell no. During the day, I don't say anything. But at night, like I said, the ones at night that started like that was after my husband left, which is what I had to be, what made them worse.
Mhm.
Sorry, it gets to
So
me
this,
because my kids were only 2, 3, and 4 then. So none of them could help me then, And they have autism. Making sure they don't elope. They would elope. Like I've said to people, I know how it is to have a missing child. And that's why I follow Sebastian's case so close. Autism, elope, possibly, whatever. Anyway, so we were all sleeping in the same room. And I had a bed away from them just in case, because I knew I had grand mals at night. The first one threw me literally from one end of the bed to the other. And by the time I got to that end of the bed, I was fully awake and had to cough. Literally, I had to cough to get my heart to go right. That was the first one that was like that. And I remember I was really extra. It was about not long after he left that that one happened. And then I figured out the CoQ10 part with the heart, which I got a cardiologist when I was pregnant with my last, thankfully. And she had my first visit with her. She said, I recommend CoQ10. And I didn't think, at the time, hello, that's for the heart. I should have told him. And I looked at her. I said, I started that already. And she said, you told me that was in the past. That would make sense. But with the seizure part, I mean, I had a really good neurologist. He was the best in town. He retired last year. So now I was trying to hurry up because I knew everybody basically was seeing him and try to get a really good one. Found a good one. He was booked, ended up with his nurse practitioner. That's where I'm at now. She's tried to prescribe medicine that would actually cause more seizures.
What is she trying to prescribe?
A migraine medicine is known to cause seizures. When she's trying to tell me the pain in my head from the Ehlers-Danlos syndrome was migraines, I'm like, no, that's from the nerve pinch in my neck. And she was like, you need this for migraines. I'm like, no, I'm not going to cause more issues. And then their EEG machine's always broken. They don't answer the phone. So I'm like, I'm stuck right now with getting neurologists because I keep calling around and they're all booked or not taking my insurance. I'm having the same issue with my kids and finding an eye doctor right now. But it seems to be around where I'm at, they're booked.
Random, if you want to put in the back chat, I may know somebody in your area or know somebody that would know a good neurologist, if you're comfortable. But if not, then
How do you use back chat?
you just put it on, click on
Oh,
chat.
I see it. Okay.
So I have a friend that lives in Oklahoma, and he has MS, and it's a neurological issue, and it took him years to find a neurologist. So I don't know why, but yeah. So continue. Sorry for interrupting.
Okay, I'm gonna rack. Ironically,
Random. Let me give you a couple of things that you can do. Okay. At the moment, you're going through tremendous stress, right? When your brain relaxes at night when you're sleeping, that's when the seizures happen. That's exactly how it happens to me. Most of my seizures are in bed now. They used to happen when I'm walking around, and it would happen, and I've broken almost every bone you can possibly think of. But now mine are usually in bed. First thing is that your seizure probably lasts about 15 seconds. That's it. But it takes 15 minutes for your brain function to go back to normal. So yeah, it's a good thing that you're keeping space between you and the kiddies. But at the moment, what you're doing is you're stressing yourself about the situation you have gone through, and that's your main concern. Have you considered counseling at all for your breakup and what what is worrying you at the moment?
random. I just gave you a recommendation of actually the person that I see. So
Yeah, because it's a good idea for you to look into getting some counseling, some therapy as well, which would help let out some of your frustrations and your concerns and your worries, which will help a lot towards controlling your epilepsy.
One of the things that I think is important is the general public to know what they should do if they see someone that's like looks to be having a seizure or is having a seizure. Because it, is important, especially if someone's out in public and then they're brought to the ER. So I don't know. I can talk about some things that would be important if that's something that you would like, Eddie. But
So one thing I learned about, you still there, Random? All right, hold on. I think she's backstage.
okay.
Give me, she's got another thing coming up. Give me just a second. Is that you?
Yes.
Okay. All right. Okay.
Hello.
Just had to double check because there was two of you backstage.
Yeah, somehow whenever I went back to the back chat, it exited me out. So I couldn't, when I was trying to reply, nobody could hear me. So I realized it half dropped me. It showed me on there, but on there.
So one thing I've learned, to tell me if I'm correct, okay, or wrong, either or. When you see somebody having a seizure and they're on the ground shaking crazy, I was told just to give them head support.
Yes.
Right. And
not to stop them, not to hold them, just to give them head support. That's it.
I've been injured by somebody that tried to hold me during a seizure.
So that's correct. The other thing you want to do is make sure that they're not around anything like sharp objects.
Yes.
Make sure that they're on their side if at all possible. So if they start to like vomit or anything, they don't aspirate on it or they don't choke. So putting them on, like, just trying to kind of make sure they're on their side if at all possible. And the most important thing that we're going to want to know, or that they're going to ask you, is start timing it. Note the time that the seizure begins and the time that it stops. Because that's going to be the first question that EMS is going to want to know, and that they're going to give us in report when you bring them to the ER. And then you're going to want to, obviously stay awake with them, and then, like I said, protect their head, or you were saying.
Mm-hmm.
If they aren't on the ground, you want to just make sure that they get to the ground safely, and then don't try and interfere, if that makes sense.
Correct. Yep. I had a friend that was a known epileptic. I just didn't know much about it. I just knew that. Don't pin them. I learned, I was taught that. I've just never done research, and I didn't realize how seizures and depression are connected, or mental health disorders are connected.
One thing that I was told by my ex was that when my ex would tell me, it's okay, you're fine, you're okay. Apparently, I was responding to that. And then I used to be told, come on, you can sit up. And would give me a little help to sit up. And I would sit up. I didn't remember any of that. But apparently I used to respond to helping me, to calm me down, to help me wake up. That's what I was told. I don't know if that actually works or doesn't. I don't know.
Just most people, I don't think, know, especially if you're not experienced to being around someone that has a seizure, to the timing thing, because that also, like, if people haven't been diagnosed with seizures, that the timing and how long they last and like what they're doing, and taking note like mentally of what they're doing during the seizure and how they're behaving, can help us identify the type of seizure they had and maybe what treatment may or may not be needed.
Yeah. Random, I don't know if you answered my question. Have you considered looking into getting some counseling or some therapy, somebody you can go and talk to about your
Um,
whatever it is that's on your mind?
I actually, can y'all hear me? Hello?
Yes.
Okay. I actually recently was referred to somebody that does like over the phone. I was actually referred through DHS for this one. And she actually does, like, she calls every 2 weeks and she'll tell me what I can do different. She's trying to get me to understand more, which I started learning grounding on my own. I'm not good. I don't like walking barefoot. And she's taught me grounding that way. Grounding, like if I get it, because she's wondering if anxiety is causing the seizures. And she said if I start to feel an aura, maybe it's anxiety, try to do grounding by focusing on stuff around you. And I told her, I said, I do that when I feel an aura trying to get my brain away from the seizure, thinking it's going to work. So I guess kind of I've already been doing that. But like the last time she called, I was frustrated at the moment. So I actually was able to vent, actually get it off my chest because I don't really like. I have a friend, well, not anymore, but there was a friend that I called at 2 a.m. She told me to call her because she had happened to be up. She was like, "Hey, how are you?" I was like, "Not good right now," because it was on the anniversary of my cousin's unaliving. And so she, I thought she would be good to talk to. In the end, I had to tell her, look, I'm trying to keep myself going. That's not helping. So that's the kind of friends I had. She's
Yep.
also, I've had another one tell me I was faking the seizures for attention.
Yeah, I've heard that one. Yeah,
Yeah, I'm going to
yeah,
fall on the floor and almost hit my head for attention. Yeah.
yeah.
So,
I've heard that too. Yeah, yeah. Somebody I know really well had told me that, and I just
yeah.
smiled and walked away
Well,
and never spoke to the person
my
again.
my husband actually told me in like 2000, I want to say it was whenever we had our second. So 2013, 2014. I was having seizures because I didn't believe in Jesus.
Mm-hmm.
Oh, okay. That's a new one. I've not heard that
Because
one.
we happen to just have him, and hello, I wasn't going to church at the time, so because of that, I was having seizures.
You're saying, like, basically trying to say that the stress that you found and going back to church.
Yeah, right now we haven't been since before Thanksgiving because we had transportation issues because I cannot drive.
Mm-hmm.
I have epilepsy, so our transportation is my husband. He has our van. That's another whole different story. Yeah, our van that's for our kids. He uses. He's taxi. He does.
Yeah, that also creates a mental health struggle when you're, especially if you're, not able to drive and dependent on other people for transportation. That's something that can affect your mental health, making you feel trapped and alone. And
And whenever he was going to be able to take us, like the week before, that week before I had the breakthrough seizure, we were talking about, hey, I'm going back. You're gonna take us, right? Yeah, okay. We were planning it. Had that breakthrough seizure. I haven't been back since, and I've talked to the pastor twice. And I've told him, I said, I understand that y'all have medical people there that understand seizures, but the point is, it's 100 people in there. I already have social anxiety, and I haven't really been out in public since I've had seizures because I know from the last time I had a breakthrough, I had anxiety attack that turned into a seizure, and it was really bad.
Yeah, I when I was diagnosed with Jackson, and that happened to me, people will look at me and they would think that heroin is very common. I live in Glasgow, live in Scotland, and heroin is fairly common. People will think that I haven't had my fix yet, and it used to be so embarrassing for me that I actually stopped going out for 2 years. I sat at home, and then I realized that if I'm not going to make the move, nobody's going to help me. I'm going to have to do that myself. Uh, I know that Eddie prefers religion and politics not to be part of it. So I'm going to generalize it. If you are into faith, that's great. So whatever help you can get that. But right now, your biggest issue that I hear from you is constantly thinking about everything that's going wrong in your life. Uh, so the way to start thinking is like your therapist said, ground yourself. So every time that you start to worry about things, ground yourself. What is in front of you that needs resolving? So if it is like you're hungry, what do? We don't think about anything else but to feed ourselves. So live your life from one moment to the next. So your personal needs and your kids' needs. Keep your life as simple as you possibly can. And that would help towards is I had to learn different ways of living my life. The person I was before, the person I am now, and I have to constantly evolve as the time passes. So instead of you stressing about everything, just worry about the next step that you have to take. So I take it as late afternoon just now where you are. So next thing will be if it is dinner time, just worry about the dinner time. Don't worry about anything else. So you focus yourself, uh, make a chart or give yourself little projects that you can do. We call it steps in NLP. So if you're walking, if you need to go to the kitchen, you take one step at a time to go to the kitchen. So you need to re-educate your brain to do step by step. So wake up in the morning, what needs to be done? Breakfast needs to be, you need to make the breakfast for kiddies. So you concentrate on that. Once the breakfast is done, what needs to be done next? Washing dishes. Right, so that's my next project. Once you complete that project, then think about the next project that you need to do. Live through that. That would help you de-stress yourself to an extent. But it's a
You're
practice,
welcome, Crimson.
practice, and it will get better for you.
That makes a lot of sense. When we moved here in April, and with my pain, I'm not able to do much. So I haven't really been able to get this place organized. And just like I want to say a few weeks ago, I was like, okay, the only way to get this done is as you said in that sense, step by step.
Yep.
So my kids' playroom went from chaos to, oh my gosh, they can actually see some toys. So that actually makes sense to be able to do on that part too throughout the day because I've
Yeah,
managed to get somewhere,
yeah. And
which is
nothing has to be perfect, especially when you have kiddies. The
true.
house is never clean, the house is never tidy because you have kiddies. And kiddies' job is to make the mess and then expect parents to clean it up afterwards. We all done that when we were kiddies. We did the same thing. So step by step, make yourself projects, small projects,
One
and
did.
concentrate on those. With regards to transport, now I'll give you the
Now, so
situation.
P. Barnes, in the States, I'm pretty sure transport is different than over there. Have
Oh
you
yeah,
checked with your insurance provider? Random.
Huh?
Have you
What?
checked with your insurance provider for transport?
Yeah, we don't have any issue getting to appointments or anything at
Okay.
all. Long story short, he knows he's supposed to, since I'm disabled and he has disabled children. Although he left, he still has responsibility because that was his sponsor, his job, to make sure before he left and we're his family. So no, I don't have an issue with that. But right now, it's how do I get myself to go? Because the past few weekends, I've been like, hey, I'm gonna try to go this weekend, and I end up Yeah.
Oh,
But this time he was in San Antonio, which kind of helped. I was like, good. I don't have to be like, well, I sure wasn't going today because of me.
This is where I was going to with the transport system. We have a great transport system here in the UK. But for me to get off my backside, go into town is where I struggle. I say to myself, right, today I'm not going out, but tomorrow I'm going to go out. Then tomorrow comes, and then there is always, oh man, do I really need to go out? Ugh, I can leave that till the following day. And this is where I'm blessed. I have a really good friend who calls me every morning and he says, oh, are you going to go out? Come on, you can go out. And sometimes he manages to get me motivated enough to actually get up, get changed, and go out. And every time I go out, I do actually have enjoy myself when I do go out. So I do understand that. It's again, it's a process. I'm going through this process myself, trying to motivate myself that I'm going to do this tomorrow. I'm going to do this tomorrow because I live outside the city, so it takes me about 40 minutes to get into the city on the bus. So I'm finding my own way, and if you think about it, I'm sure you will find your own motivation to be able to get yourself out to wherever you need to go or whatever you need to do in town.
Yeah, I'm hoping so. I recently got these bracelets to put back on my person to wear that says epilepsy because the medical one I had, it kind of got worn down. So I was like, if I do go out, at least I have these. So that does help some.
That's really helpful. Did you see my recommendation before I leave?
I wasn't able to see it because of the way I had to get back up on. I think you
I
put it. Hang on, hang on just a
just
second.
check
I'll
before
check.
I leave
Yeah.
because it's amazing. The person I recommended, we're from the same area, so
Oh no.
is that who you were seeing?
oh boy.
That'd be if it.
Serena or Sarah, yes, I'm an NLP consultant, which means I'm also a hypnotherapist. So yeah,
Yeah.
with the hearing aids, my
Mhm.
voice changes based on who I'm talking to or what I'm talking about. So I
Yeah.
based on what I need to say. But I don't know if any of you on the panel noticed that Random's uh, tone of voice has changed. She's gone slightly more towards the positive side to where she was before. Has anybody else noticed that?
I did.
Yeah, she definitely seemed a little bit, more
Calmer.
relieved the more you were talking to her. And your voice is definitely very soothing. There's this guided meditation that I listened to by this guy named Jason Stephenson, I believe it is. And yeah, your voice, I'm just sitting here listening to you talk and I'm like, oh, okay, this is soothing. This is great.
I'm wondering
You
if
turn your camera off, Random. You can turn your camera off. There you go.
Okay. Real quick, can you hear me?
Yes.
I don't know if
Crimson,
Yeah.
Elizabeth Settle. I've already tried to see.
Is that who you were talking about?
I
Earlier?
believe so. I laughed out loud whenever I read the name. I was like, I
That
know that
sounds
one.
like she.
Through St. Thomas.
Yeah, out in Bellevue, but
I'm sorry. I don't know if I was supposed to say that on here, but yeah, when I saw the name, I was like, yeah, I've been there. I think that's the same one.
I'm gonna put my email in the back chat. It's not that hard, but email me and I
Okay.
can recommend somebody else.
Thank you. Yeah, I'm seeing somebody else through St. Thomas. No, I mean, seeing her and I'm trying to see somebody else through St. Thomas.
All right.
But I don't know.
See,
I'm
having
stuck right now.
support, community support is what's important. So,
And I don't know if
Yeah,
you
my
heard,
support went down.
And I also run a women's group here that I can, when you email me, I can tell you to join on like Facebook and stuff. So
Okay.
it's just a group of, women's support group and has women of all ages in it and different things that you can do and maybe connect with and find things since you're new to the area.
All right. Thank you.
But
for,
yeah.
for those of you that are here, this is off topic. Somebody's got YouTube playing in the background, or I hear an echo. Hold
I
on.
don't hear it yet.
I'm not.
Okay. I think I fixed it. Yep, I did.
Random, I don't know if you heard it, but Eddie and I and the others on the panel picked up that your voice has got calmer and you're more assertive than
Yeah.
you were talking.
Yeah.
So,
I think you needed this,
reason
Random.
I'm saying this,
Yeah, I do too. Because ever since I've had that breakthrough seizure, I stay on edge. And I mean, my one friend that I talked to that she could come over is the emergency person. I mean, I messaged her the other day. I said I had 3 last night. She was like, 3 what? I'm like, I have to keep telling her seizures. And then she'll say, well, how are you now? I'm okay now. Okay, good. I'm like, she doesn't fully understand.
yeah,
Sarah,
not everybody.
So
no.
I really don't have anybody that does understand
Well,
either
now you have it.
Ehlers-Danlos syndrome or epilepsy.
You now have two people that do understand what you're going through.
Thank you.
And I'm
It's
just
always a
learning
pleasure.
about it.
I'm glad that I happened to get on yours yesterday. You're live. I was like, who's live right now? Because I just wanted to try to relax. And I was like, and then I saw, I think it was Gregory said, can you do a topic on epilepsy? I was like, I was meant to come on this live at that time.
It's amazing how things work out. Like, I got booted from going up and discussing a case. And so I came into Eddie's because I'm big into mental health. That's my niche in nursing. I love the rush that I get in the ER, but I was the mental health whisperer for all of our patients that would get, sometimes be there for days in the ER while we get them placement in facilities. And one of the things that, you also see because of it so prevalent is, we have the frequent flyers of people that come in for epilepsy and seizures. So, this channel, although I found it through when he came in, Jay and everything, it speaks volumes to me anytime I can come up and help, whether it be something like nursing related or just, whatever. And like I said, it just, what are the odds too, random, that you happen to be randomly from the same area? And
True.
Everything happens for a reason. I wasn't
right.
planning on coming. I wasn't planning on coming to the stream today. A friend of mine, she's my standby friend today. It's one of my most difficult days of the year for me. And she messaged me, she said, all things serious,
Turn your camera off, Sarah.
you'll be interested in that. And I looked at the epilepsy and I went, oh, that's going to be too much work. So I said, oh, good, go in and let's see. So you and I were meant to meet today. You and I meant to talk today about the subject. So everything happens for a reason. I'm glad that we met. I'm glad that Eddie chose a very good subject.
Yeah.
I never understood how it connected so much to the mental health until I had the breakthrough seizure. And I was like, it's something connected to something that happened, not physically. Because Okay, we went to the dancing lights of Christmas. Yes, it's a lot of flashing lights, but I don't look up. I will not look up at the lights. So I know that's not what did it. And so, like I had said to him, I've been trying to figure out, and I'm like, it has to be something dealing with anxiety, depression, somewhere in there. Because right before Christmas is when it happened. I didn't think my kids were going to have much to open. I asked my daughter's speech therapist to pray that my kids' letters were answered through the Operation Santa.
All
And
right, Chris.
they ended up sponsoring my kids. So my kids got something to open. But after that, I was still having them. So it's like, I don't know what caused this. If it's not that, what was it? But the night before last, I did not have one. Last night, I had 3. The night before that, I had 2.
It will get better. It will get better. You just keep to the mission, the projects that I've given you. So you just go with it, and as the time passes, you will find your way around it. There is not just one way. We all think differently. We all process information differently. So we will find our own way, and you will find your way. And if I can be of any help, then Eddie has my email address. So I'm more than happy for Eddie to give you my email address, and you can send me email if you need any advice.
Thank you. Thank
I'll
you.
be more than happy to help. Just keep in mind that I'm 5 hours ahead of Eastern Standard Time. So I
Okay.
live in American Eastern Time. It's 5 hours. So here it's 11:42 p.m. where I am. So I might
Wow,
not
it's
be.
5:42 here.
Yeah. So keep that in mind. But I always when I wake up, I always check my emails because they pop up on my mobile phone. So I always check my emails. So as soon as I see your email, I'll be more than happy to reply back to you. I'm very good
Okay,
with emails. So yeah, if I can help you in any way, then I'll be more than happy to do so. If you can wait another 3 years, my nephew would be a neurologist by then. He's studying to, but you're gonna have to give him another 3 years though.
that's cool.
3 years. That's a long
One
time.
way I realized to lower stress, like we had chaos a lot. 2024 was just chaos. So, 2023, 2024. So I homeschool my kids. Well, I realized my oldest, he has high functioning autism. He's a genius. He can tell you the presidents from today to the first president without looking at anything and tell you facts about them. I realized he has hyperlexia like me. He's teaching himself science and history. My other kids are doing the same. My lower functioning son knows every anthem, knows the flags. He's been teaching himself. I thought, why am I pushing to do every subject? I decided to unschool on everything to see what would happen. My 6-year-old can actually read.
That's great.
They've been
So
teaching
kids
themselves.
with autism, that's their superpowers. They have
Oh, they have
superpowers.
hyperlexia.
They're amazing,
I
really.
taught myself accounting in 8th grade. In 4th grade, I didn't understand reading comprehension. I was having help with that in school. My brother could not stand algebra. He could understand reading, so he was complaining and mad about it. I said, "Give me your work, and I'll do it. You do mine." And he was like, "What do you mean? You're in the 4th grade?" I said, "Just shut up and give it to me." I read it. I did it. He didn't. I got none of them wrong. I was already teaching myself algebra by listening to him and his friends. So when my son, my oldest, I realized he was teaching himself how to read at 5 years old. My other son, he was nonverbal until almost 4, but talking with his mouth closed starting about that time. He was reading before he could talk.
Wow.
He read this sign at this park, which was a really long sign, with his mouth closed, but we could understand him at through almost 4 years old.
Yeah,
But
my best
my
friend,
daughter,
his son, my best friend, his son is autistic, and I told his
Mhm.
dad, I said, your son is autistic. He needs to be tested. And he's like, no, he's not. He just had
I've had
speech
that
problems. I'm
happen.
like, no, I understand it. I understand signs of autism. He has it. He needs to be tested. And he took him and got him tested, and come to find out he was. And, you know, now that he knows, he's able to work with his son a lot differently, because teaching and working with somebody who has autism is different than teaching somebody and working with
Uh-huh.
somebody who doesn't.
Uh-huh.
And, you know, some of them are color sensitive. Some of them are taste sensitive. You know, you just got to figure out which one. And the last time I saw my nephew, because he's like my nephew, because his dad's like my brother, well, is my brother. I said to him, you know, how you handle your other two is different than how you're going to handle Ethan. And you'll appreciate it, trust me. And the last time I saw him, like, he was talking clear words.
Oh.
I was like, wow. Because he used to say pipa instead of pizza. And he wouldn't even say, you know, can I have some? He would just say pipa, 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 just
Yeah,
repeatedly until you gave him pizza, right? He was like, he was verbal but nonverbal at the same time. Like, he would say certain words and that's it. And when he would talk, you couldn't understand what he was saying. Now he's clear because he's been taking speech lessons.
I love that.
You know,
And yeah, they can customize, you know, now that he got diagnosed with autism, they can actually, you know, customize the teachings to his needs that he has. You know, like if a kid isn't autistic, but they have speech delays, like my nephew, he had a lot of excess fluid in his ears. So they thought he was autistic because he wasn't speaking properly, but he got a hearing test and he couldn't hear, and they looked into it and he had excess fluid build up in his ear, so they put tubes in, and then all of a sudden he could start hearing, but his speech was still a little bit delayed. So that takes a different type of instruction rather than a child with autism who has, you know, speech issues that needs another special type of learning. So the diagnosis, you know, you get a good specialist. Once you get a good specialist, and you know, you can go so much further. You know,
yep.
it's just
And,
the whole point of finding that medical professional who can give you an accurate diagnosis, because you know, behavioral psychology, you know, cognitive stuff, it's all really difficult sometimes, because most of the time with epilepsy, you know, there's often, except for with the specific type of epilepsy, there is the EEG and MRI and everything. But like with cognitive stuff and a lot of psychological stuff, there's no like blood tests you can take, or sometimes, you know, a lot of times no brain scan you can take. So you need a really good specialist that can pinpoint what you're going through and customize your treatment, because I
yes,
think that's key. That's what we need. I think that's what I really think that you need that really good specialist that will like go leaps and bounds for you. Like my cousin, sorry, I'm rambling. I got a lot. My cousin, she had this disorder. It's called a pseudotumor, and it's a disorder where your brain thinks it has a tumor, but it does not. It's like a phantom. Your brain thinks it's there, but it's not, and it was causing excess spinal fluid buildup. And she would have seizures too. She would like one of them caused an accident because she briefly looked down for something and, looked back up, and it caused an accident because it caused a seizure. It took forever to get this diagnosis because it's such a weird thing. Who would have thought your brain can make you think you've got something that's not there? That's why I was saying the brain is so, we know a lot about it, but there's still a lot that we don't know. Like a lot of, like the pineal gland in the center, they're starting to understand it, but there's still a lot that's unknown. It just fascinates me. That's why I'm going into psychology myself. All right, carry on.
So I was reading, and it's just amazing how much you learn by reading. Some people like to read. Go ahead.
Sorry. Mentioning the pseudo tumor, I was on the depot after I don't know which one, after my daughter, and it had caused mood swings, so I got off of it. But that's about the time that I started having the pain. And at first, it was in my head, my left side of my face, my shoulder, my neck. So the neurologist was thinking it was a pseudo tumor causing the pain because I had had the depot and it had just come out that can cause that. He did all these tests and he was like, no, you have nerve compression for the pain. So I've heard of pseudo tumor before. And that I had gone down that looking about the epilepsy too. I was like, whenever he had brought that up, I was like, could that be causing my seizures? And he said, no, we see activity on the EEGs. So he was like, it couldn't be that. He said, but you do have stress that's causing them too, which would bring in the other type of epilepsy. Stress and anxiety can cause them too.
I had one of those EEG, 48-hour EEG, which was
I had
pretty
to wear
cool.
one at home. I had to wear one at home, and I was still going to go outside because I smoke. I was still going to go outside and smoke. And my neighbor looked at me and kind of wide-eyed. I'm like, yeah, I know I look like an alien, and just kept going. But I hate those
That's
things.
funny. Yeah.
I wanted to take it off within the first day because it itches. But yeah, I've had 72-hour EEGs 3 times.
Oh, wow.
I had 48 once. It was itchy, but I smiled. Kiddies were a bit scared, but everybody else was looking at me, and I was giving them biggest good enough possibly could find. It was a lot of fun. The way I cope with my depression and my seizures is I try and find a funny thing that I can turn that into, because it's really easy for us to find ourselves getting depressed because it's just how we are programmed based on our culture and society. So I try and find funny ways. My dad, God bless his soul, he was a surgeon, and my dad used to feel really bad for me for epilepsy until I told my dad. I said, "Dad, it's a blessing." He said, "How?" So when I have a seizure, I sleep for 2 days, which means I hardly use internet, I hardly use electric, I don't eat, so it saves me money. And then my dad laughed. And after that, that was the last time my dad ever showed any concern or worry. So I always try and find a funny way of looking at it or a positive way of looking at it. But then again, I have to say it took me 2-3 years before I was at that mindset where I was able to see the funny side of what I have.
I've learned to deal with stress by humor,
Humor is
Yep.
the best.
especially like late at night. I'm ready to go to bed. My kids are still up, and I hear somebody ask for a snack. Instead of getting mad, I'm like, the kitchen closed 9 hours ago. Or I need another refill. One
Need to
time
use
I
that
actually
one.
did this. My son asked for a refill. I said, do you have $10? He said, no, why would I need $10? I said, I'm charging for refills because I need to sit down and you're making me get up. So he's like, no. I said, you better find $10. And he was like, what? I said, you have a phone. Tell your daddy you need $10. He messaged his daddy for $10.
That's amazing.
Hang on though. Then his daddy's asking why. He messaged back and said, Mama's trying to dehydrate me unless I give her $10.
Oh, that's dramatic. That sounds like something my kid would
My
do.
son knew I was playing.
Mm-hmm.
because I started, whenever I would get stressed, I'd start joking about it. I'd be like,
Yeah.
okay, you have to. And like with the
Oh yeah.
pain for a while there, I was doing like Dory, just keep swimming to get from one thing to the other. I've got dishes done. Okay, just keep swimming, just keep swimming. We're almost done. But that quit working about 2 years ago when the pain got worse.
Yeah. Yeah. You have to constantly evolve because don't forget our brains evolve all the time. So we have to evolve ourselves as the
Yeah,
time passes to be able to accept and keep moving forward.
Yeah. You have
Uh,
to evolve and adapt.
yeah.
yeah. And it's not about coping, by the way, because we don't realize the power of words that we say to ourselves and we put out there. Hope is something I never use. It's life is about stages that we learn new things because we evolve. We don't cope, we evolve and find some new ways and new paths to make our lives better or easier to live with.
Random, I have a question for you. How is your post-ictal? So the post-ictal, as you probably know, is the period after the seizure. Like P. Barnes said, like he sometimes will sleep for 2 days. I'm just curious on like how does your body react to that? You get really exhausted too? Because when my daughter had her grand mal seizure the day after Thanksgiving this past year, she slept for like 4 hours. Like they were like 3 hours away. They had to take her to an ER in the North Woods of Wisconsin because they were in the UP of Michigan. And, I'm just curious on the difference between the type of seizures you have and the ones that, can be seen on an EEG. Do you get really exhausted?
I get really confused.
So you're kind of in a brain fog, kind of out of it,
Yes, and
you know?
anxiety,
Okay.
confusion, and anxiety all at once, and then the rest of the day, exhausted.
Okay. Okay. Yeah, I was just curious about that because, if there's differences because, your body, is reacting, you may not have the EEG activity per se, but your body still is like going into this seizure mode and there's a lot to it, it's doing a
Hmm.
lot of different things. And I was just curious about that, if it's the same for you as it is for a lot of other people or if there's differences. So yeah, thank you for answering that. And also one other thing I kind of thought of when we were talking and P. Barnes was giving his amazing insight. Have you ever thought of journaling?
I
Kind
tried
of,
that. I
you
tried
tried
that,
that?
and guess what? I forget.
You
I
forget,
even had
yeah.
it. I have okay. Where I'm at now, I have this one little room that's mine, and to be honest, because of the pain, the depression, and the seizures, now I kind of isolate, and I don't
Mm-hmm.
really have my own bedroom
Oh,
because my kids
okay.
have a playroom, and since like I said before, how they elope, we're so used to mama sleeping in one of the rooms with one of the kids.
Oh, sure.
Okay, so I have my own little room that's an extra bathroom.
Mm-hmm.
So I will sit in here and just chill, relax, watch
Mm-hmm.
shows, or that's where I'm at right now to afford to be quiet. Because yes, my kids do have their iPads; they have to right now, right? But um, I lost my train of thought. I hate
About
when that
journaling and
happens.
forgetting. Yeah, you forgot about
It happens
journaling.
all the time. What
Yeah.
did you ask?
I asked if you thought about
Oh yeah.
journaling. You said you
So
forget
I have
about
that
it.
right here where I could see it every single day.
Mm-hmm.
And I was doing good because I was like, I need to start writing down. I was mostly trying to look at stress and the pain. This is before the
Right.
seizure started back. I haven't even journaled since the seizure.
Okay.
But yeah,
That's
I
good.
need to get back to doing that because that does help when you look back and be like, okay, like for
Look,
example, the pain and what could I not do or not do that day. Hey, I was
looking
able
at
to
your.
push through. I made it through that. Or
Mm-hmm.
there was a lot of seizures here, but hey,
Yeah. That way
I
you can kind of
yeah, I tried.
track. Yeah. Yeah, like there's different apps too. I mean, there's actually phone apps, and a lot of times, like, because I used to do like a gratitude journal
Hmm.
where you would like write down just 3 things you're thankful for, which I think is a great practice, either
That
way.
didn't help me.
That didn't help you.
I tried.
I'm so sorry, but there's different. I think there might even. I'm sure there's like even. Cause I know there's migraine journals because I get migraines and I've had those before. There might be like seizure journals or
They
health
have those,
journals.
yeah.
Yeah.
And then I have hypoglycemia too. That's where your
Um,
blood sugar's low. So
yeah.
I don't test it anymore. I can't stand blood or needles. I know when
Sure.
it's getting low.
You can
Um,
feel it.
I've actually know the difference between a seizure from low blood sugar too.
Yes, that is
That's actually
possible.
happened.
Mhm.
So I know, like, in the stressful days where you don't have an appetite, I have snacks right there that, hey, I haven't eaten. Let me at least have this. It's got some nutrition in it, so
I
that
mean,
wouldn't happen. But yeah, I used to journal when I had my seizures, and
mhm.
honestly, it became depressing to look back. That's whenever
Oh,
I was having them really bad,
yeah.
throwing myself around on the bed.
I'm so sorry about that. That's tough because that
But
was
I
the
am
thought
like
that popped in. Yeah.
But I'm like my sons, which is why I think the specialist correct. I need an evaluation. I can remember the past week how many I had each night.
Mhm.
Like whenever I went for the hearing and they asked me about the past week on seizures, I could tell them
Yeah.
exactly how many for each day and what happened where I was.
You
Thankfully,
know. Oh, sorry.
thankfully I
use
can remember
right.
that. But brain fog with a lot of short term is hard. Epilepsy medicine. I was on gabapentin for Ehlers-Danlos syndrome pain. Brain fog is even worse.
Yeah. Yeah. Gabapentin can make you tired and
Oh,
kind of out of it and spacey.
gabapentin made me think I was going insane.
Oh, yeah. I mean,
I
it's
was
got
having
a.
I was having panic
That's
attacks, going to the hospital, thinking I was having heart attacks. That's how bad it
Yeah.
was. And then my
that's the reason
neurologist said
why.
you need to get off of that ASAP, but not too fast because that's what your problem is. When I got off of it, the panic attacks were lower. I knew who I was in the mirror again. That's how
Oh,
bad it got.
good. Yeah.
And then
Oh,
with the Tegretol, I can only take 100 milligrams in the morning, 100 milligrams mid-afternoon, 200 at night. Any more than that, that's toxic. That's the lowest dose that you can do for my body size.
okay. That's the carbamazepine. I had to look it up. I'm a pharmacy tech,
Yeah,
and
I can't do anything but Tegretol. I can't do Epitol, carbamazepine, Carbitrol. It has to be generic Tegretol, or my seizures are a lot worse.
for you, huh?
But I've tried Keppra.
Don't.
That's part. I think Keppra is what partly ruined my marriage.
It gives you mood swings.
I
That's
had
why
rages.
I wouldn't put my daughter on it because she's 8 and she's approaching, puberty age. And
Hey,
that's what
hey,
the neurologist. Oh, I'm
can
sorry.
we can we not talk about medication
Oh,
Oh,
publicly?
I'm sorry, but yeah, I
Because
have tried 10 different
yeah,
ones, so they figured out it's refractory, and or what's the other word? Intractable
okay.
and that's really why I'm lost because at my hearing for disability, the lawyer said she has intractable epilepsy. I'm like, red flag, people. Hello, medicine does not control it.
Correct. You need to.
What? What the? You
I
know?
wish you would find like an amazing specialist because it's crazy because I've been dealing with some symptoms I've been having migraines since I was a kid, and I have a neurologist who I see like once every 3 months I do get Botox for my migraines, and it works pretty well. And sorry, Eddie, I didn't mean to say medication, but
Real quick,
I
that I had that for migraines too, and that made me have more seizures.
oh no, that's awful. But I said one time to him because I was just feeling worse and worse, and I'm like, look, I feel like crap. I don't, am not feeling myself, and it's just getting worse. And he's like, okay, like he sat and he listened to me, and and unfortunately, that can be really hard to find because he ran blood work, he did an MRI on my brain to make sure because the headaches were so bad, and I have so many other symptoms. Turns out that my blood work showed I don't remember the blood testing, but it showed the antibodies are the ones that indicate autoimmune. So I have to see an rheumatologist, that word, soon because they think I have lupus, which is manageable. and it gave me answers, but it's just like, oh, great. What else? But you know what I mean? But it takes just that one doctor, that one specialist to just listen and be like, let's do this, this, and this. And that's what I want for you so bad, because I hate that you're going through this, because you seem like such a kind person and you bust your butt with these kids. Because being a mom is hard. I have one 8-year-old that I have, her dad and I share custody. So we each have her about 50% of the time. She wears me out. And you have, you said you have,
24/7.
yeah, you have 3 kids, you said, right?
Well,
And 2 of them are autistic, and yeah,
I have
they're
3.
amazing.
She's got 4. She's got
Oh,
4, Sarah, and 3
they're,
of them
you
are autistic.
know,
3 have
autistic.
autism.
And autistic kids are amazing. They just learn differently, as you know, and they have special, you know, needs that you need to tend to. And it's exhausting, but I mean, it's rewarding, but you're still exhausted. So you having that little space for yourself is amazing, in my opinion. You know, maybe making it like your sanctuary if you can, you know,
That helps because I actually feel guilty that I sit in here.
don't, you need that as long as you know your kids are good.
Thank you. I actually will sit down and be like, I just told them I have to sit down.
Yeah.
I'm tired of saying I have to sit down.
As long as you know your kids are good, they're safe, they're taken care of, they're, you know, distracted with what they're doing and they're happy, you take the time you need, because you're a mom and you are
Thank you.
busting your butt and you've got this stuff going on that's it's stressing you out and it's causing you other health problems, because, you know, as they've ruled out the the neurons. Yeah. So yeah, you deserve it. You need, I think a lot of it is you need to see what works for you, and it takes a lot of time, but having that space for taking that time for yourself and allowing yourself that space, you know, that's, in my opinion, that's a start, because then you can think, being able to think clearly. And because, you know, our brains are always going crazy, especially as moms or caretakers, or, you know, having a job or having responsibilities, our brains are going 90 miles an hour. And having that space to be able to just think and do what you need to do, or read, or listen to a show.
There's an easy
Just like
solution.
I'm
There's an
sorry,
easy
Eddie?
solution.
Oh,
Random. What you need to do is you need to agree with children that between this and this time will be mommy's time. So
Yeah, they know whenever I'm in here that, like right now, I told them beforehand, I said,
yeah,
I'm going to be doing something. Only you've got your snack, you got your drink. If you need anything, let me know. I've had one knock on the door twice. That's it.
yeah,
Because, you know, they're 6, 10, 11, and 12. So
I brought up enough monkeys to know these things. I call them all monkeys, by the way.
I used to be a helicopter mother, though. I had to be right there with them.
Yeah, the more you give
that's
them, the
why I
more
say
they
that's
accept.
just like the kids all need breaks. Sometimes so does mama. No need for
Yeah.
guilt.
yeah, you
Thank
need a break too, Mama. We all do. And you deserve it, because you're hardworking. You may not work outside the house, but your job is still hard and you deserve that time. But I have to hop down. Random, if you ever want to contact me, I can give Eddie my email address or drop it in the back chat. I'm on Discord too. I don't know if you are.
No,
But
not
if you,
anymore. I
okay.
used to play Roblox and be on Discord, but I saw so much on there that was negative. I was like, I need space on my iPad anyway, and took it off. But yeah, I used to play Roblox to help. I haven't played that in over a week.
Yeah,
Random
I'll drop.
I'll tell you this. There's no negativity on my Discord. Just saying.
Good.
So if you only
Good.
join one server and that's it for your mental health, my server, there's no negativity. I don't put up with it. If there's a negative comment, I
Good.
delete it. I reach out to that person. I have a conversation. You know, I yes.
That's how it should be. But yeah, I was like, okay, this isn't helping me any. You know, if you read negative, 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 what are you gonna? You're gonna.
Yeah. Yeah.
Yeah, it's gonna affect you. So, but yeah,
Thank you
might
for
have to
coming
look
up,
into
Sarah.
Thank you.
No problem.
Well,
Just drop me an email. I dropped it in the back chat if you want to connect. Shoot,
Thank you.
if you just need another mom to talk to, like dudes, get great advice to other dudes because, they're guys and women sometimes need other women. So let me know if you need anything, okay?
Go ahead, P. Barnes.
Random, when you were talking about writing, was writing helping you back then?
Huh? I was writing helping. Yeah,
Yeah.
it helped get out like how I felt.
Okay. This time, start writing again, but don't read it. Don't read it to yourself afterwards. Just write.
Okay.
That's your outlet. You don't have to go back and read it again because that's what I do if I manage to remember it. So I use my mobile phone for writing. So I write it and I leave it there. I've never read any of my notes that I've written, no matter what. So if writing has helped you in the past, start doing it again whenever you remember. Just remember not to read it again. Just write for the sake of writing. It's
All
another
right.
outlet.
Yeah, I learned to do that way back. I was actually going to write a book about my childhood because
Hmm.
I read Dave Peltzer's books. I don't know if y'all have ever heard about him. He wrote a book called A Child Called It.
Yep. Yep.
You've read it? Well,
Yeah.
other than the stabbing in the stomach that he dealt with, I basically dealt with all that. But anyway, I was going to write a book because I was like, I never had actual help when I was put back in foster care at 13. I kept asking for a therapist that would help with that. No, 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 you don't need that. I've never had help with it. So I thought, I'm going to write. I wrote a poem book that I still have. I have. And then I was writing down memories and stuff. And I've gone back and read it. And used to, it would get to me. Now I'm like, I made it through that. And my kids are not going through that. I've broken the cycle. So it actually helps because I won't even spank my kids. I mean, hello, 3 have autism. Are they going to understand it anyway? No. So that's actually helped
I'm
to be able
actually
to do that.
enjoying now. Random. I'm really enjoying listening to you now. You're out of your shell, and it's so nice to hear how your voice has changed, how your way of thinking has changed. I want you to hold on to this now. This feeling that you have just going in your head just now. I want you to hold on to that. And when you are starting to feel going down, remember this state of mind that you're in just now, and remind yourself that you can be just like this, just the way you are just now, the happy you are just now. You just remind yourself, I can be because I was. I did it
Yes.
before. I can, and
Thank you. Yes.
that will solve about 60% of your issues that you currently are facing. You have it in you. We all have it. We just need guidance sometimes, and you got it. Just hold on to this. What you're doing. Uh, Maybe after the show finishes, back, listen to yourself. This part that we're talking about. If you can cut it and use it to listen back to yourself to help you get you back into this positive state of mind that you're in just now, that will help you.
Thank you. Yes.
It's always a pleasure. Like I always say to Eddie, I'm always happy to help. A friend of Eddie is a friend of mine.
Did you guys hear a dog barking in the background or my keyboard typing? If so, I apologize.
Yeah, at first
I,
I thought it was my dog, but it's not. My dog's not barking.
Eddie, I'm not hearing any dogs barking or your keys typing. I deny all knowledge of it. So you're good. I have to have a good laugh. Because without love, the life is too boring.
True.
So
Eddie, I'm gonna love
I want to
you,
thank.
my friend.
Yes, thank you for coming up, Mr. Barnes.
It was a pleasure. I'm glad
Thank you
that
for
I
coming up.
made. And thank you, Sue, if you're still listening, for guiding me to get down here. I'm glad you did. And I'm glad that I was of some help. Random, keep smiling, Han. Oh, by the way, Han is girl, young lady in Scotland. We call it Han. Keep smiling. Do what you're doing, and you'll be just fine. You'll be just fine.
Thank you. I will.
My pleasure. It's my pleasure. Thank you, everybody, for listening. Thanks, Eddie, for letting me come in on the panel.
Yep.
And now I'm gonna
You have
go
a good
and
day,
try
Mr.
and
Barnes.
I will do, my friend. I will do. Take care, everybody, and have a lovely evening.
Thank you. You too.
Pleasure.
Thank you, Random, for coming up.
Thank you for having me, and thank you for doing this topic. And it is about the time for me to start cooking dinner, so
Yes, and
perfect
it's about
timing,
time
I
for me to
guess.
Yes.
Yeah.
So
All right.
take care, Random, and have a good night.
Thank you.
I'll
You
see
too.
you later.
All right. Bye.
Bye-bye. So I received an email to cover a certain topic. So something I didn't know that was real, like really existed. But the topic I'm covering tomorrow is rage disorder. Something I didn't know was a disorder because I've never heard of it before. And it does exist. So I will be covering that tomorrow at 4:30, 5 o'clock tomorrow, Eastern time. So for those of you who are still here, thank you for being here. You guys are always welcome back. If you have a topic of discussion you would like me to cover that's near and dear to your heart, comment below the video or comment in chat. With that being said, All Things Serious is out, my friends.
Let's talk about the mind for a minute. The kind of battles fought, you don't just win it. It's a war zone inside, no camouflage. Every thought's a grenade, sitting ready to barrage. Growing up, they said man up, but never speak up. So I bottled it all, like a shaking soda cup. Pressure building inside, I could feel it crack. But the world outside only sees the mask, not the fact. Depression knocking at the door, anxiety's my guest. They invited themselves in, now I'm under duress. But mental health ain't a weakness, it's the strength to own. Every scar, every fear, every struggle we've honed.
It's okay not to be okay. Don't let anyone take your light away. In the darkness, you'll find your voice. Speak your truth, make your choice. It's okay not to be okay. Don't let anyone take your light away. In the darkness, you'll find your voice. Speak your truth, make your choice.
Seamless like a shadow, it follows you around. But I'm breaking the silence, gonna tear it down. Got therapy sessions, journaling pages, finding peace in the chaos, flipping life stages. Self-love's a journey, not a destination. Gotta navigate the pitfalls, find your elevation. No shame asking for help, we all need a hand. Together we rise like a hip-hop band. So let's rewrite the narrative, redefine the game. Mental health ain't just a buzzword, it's our flame. Illuminate the darkness, spark the conversation. All things serious and mental health, a powerful nation.